Welcome to another episode of the Megan Spotlight series, in which we focus on topics, discussions, research and utilization of MEG in treatment of patients diagnosed with neurological disorders. Today we're excited to have Dr. James Wheelis as our guest, who is the Chief Neurologist and co-director of the Neuroscience Institute at Lobono Children's Hospital in Memphis. Hello, Dr. Wheelis. Thank you for joining us today. Let me start with a question about Lobono Children's Neuroscience Institute and how you've accomplished such a large demographic reach beyond Memphis. Why do you think this is the case, and how have you, as a hospital, achieved this?
Yeah, so great to talk to you today from Memphis. So, one of our goals as we were setting up the Neuroscience Institute at Lobono Children's Hospital was we really felt as though for children, it was critically important to be able to offer kind of state-of-the-art technology to answer a lot of questions that we have to answer for our neurosurgical colleagues when we're looking at children with brain tumor, vascular malformations, or epilepsy that we're approaching for surgery. We really felt as though for them it was critical to be able to take advantage of kind of our non-invasive testing and answer questions that we need to know, the families need to know, and the easiest way possible for our patients. So that was kind of our philosophy, if you will, when we started. But that's what led us to be, kind of the first children's hospital in North America to actually have MEG in the hospital. The first children's hospital, to have the new MEG system as well, was the idea that we really thought it was critical to the care of children that we take care of. Once we kind of did that and had it, then it made it, kind of simple. I guess the rest followed in that people from outside the area realized that we had the capability, that we were one of the few children's hospitals that did. And when they referred patients to us, it made it kind of one-stop shopping for them. They didn't have to think about, does my patient need this technology or not need it? Where do I send them if they need it? They knew that we basically had all the available technology. And if they sent them here, we'd kind of figure out what we need to use in that individual patient.
Lobono is a standalone site and you happily accept referrals from outside your area. How do you manage this from an administrative and insurance point of view?
Yes. So when we set it up, we knew we were going to get patients obviously locally, but regionally and even nationally. So we really knew we were going to need a team to help with that coordination aspect. So one is just, making it smooth for the families to get here, getting kind of the scheduling smooth. So when they get here, we have a spot for them ready to do what we need to do. And as you mentioned, kind of make sure we've got the insurance, all that set. So we have actually a team set up that kind of walks families through that process from when we're first identified. We try and make it as easy as we can for the referring physician so that, we're kind of doing, that work, if you will, carrying the load for that. All they have to do is get us the patient information, and then we work with the patient to kind of accomplish those other tasks. But I think you really have to have a team to be able to do that.
Yeah, I understand that. Lobono is one of the few pediatric centers in the US that have helped and supported such a vast amount of families. It has become a sort of go-to facility for children's medicine in the US. Did this form part of the hospital's vision from the outset, or was this a development over time?
I think it was a vision that we had as kind of physicians. We're working with the administration, and it's one that we've worked together and embraced, that our goal was really to be, a state-of-the-art neuroscience institute, both to help the children we serve and young adults, adolescents locally, but realizing this would be a national resource as well. And our goal has been to continue to kind of build upon that strength, if you will, to keep us there as technology advances.
So what are the main clinical focuses and goals of the Neuroscience Institute then?
So the Neuroscience Institute, our strengths when we started, and we started with our strengths, if you will, because that's easy to go with when you're starting a program. We're brain tumors in children. We have the largest brain tumor program for new brain tumor surgeries in the United States and North America, and epilepsy, one of the largest epilepsy programs for children in North America too. So those have still been kind of our core, if you will, that we still, key part of our program. But we've added in other components that now can take advantage of kind of some of this equipment we have. So we have added in a neurovascular pediatric stroke component. We've really extended our neuromuscular diseases, concussion clinic, headache clinic. So we've really added in other components where a lot of these same technologies will actually come to bear and help advance the state of the art.
So one more question, Dr. Wheelis. How do you collaborate with St. Jude Children's Research Hospital?
So Lobono Children's Hospital is physically located less than a mile from the campus of St. Jude Children's Research Hospital. So one of our visions with the Neuroscience Institute was to kind of leverage both of those resources and say, what do we do well, what do they do well, and how can we work together? So probably I'll give you a couple examples. The brain tumor program. All of those patients are operated on at Le Bonheur. If they need functional mapping, if they need MEG, that's all done at Le Bonheur, even though and then they may go to St. Jude for follow-up if they need treatment, surveillance MRIs. Those are all done at our facility. If they have patients that because of their treatment for their oncology problem have seizures, they're all dealt with at our facility. We do the diagnostic testing, including MEG. So St. Jude has been able to kind of take advantage of our state-of-the-art testing for some equipment that they don't have on their campus. It allows us to take advantage of some of the treatment protocols in oncology that they're state-of-the-art on that they have on their campus without duplicating it. So it's been a nice kind of marriage of resources on both sides of the street to basically elevate the care for these children that we both take care of.
So you've made large investments into the latest and greatest technology, and such as the MEG device, the Megan's TriX Neo, for example. And who benefits from the MEG in terms of clinical usage, and what is it used for at Le Bonheur?
So when we look at new technology, I mean, our first priority is this going to help our patient? In this case, I mean, is it going to help the child? Is it going to help the family? And if we really think that that's the case and it's something that's critical to us helping the patient, that's our first priority. And then the second one is backing up and say, okay, how do we make this happen? And obviously, many of the same things that benefit our patients make life much better for us as physicians too. But at the end of the day, we're driven by, how do we get better results? How do we do this in a better way for our patients?
That's good. As we are all currently operating in a pandemic and clearly unusual conditions, how has Le Bonheur and the Neuroscience Institute continued to operate and work at full strength serving your patients?
Yeah, so throughout the pandemic, we've continued to test and monitor patients. We've done it in a smart way. So, like many facilities, that extends from, our elective admissions. Patients are getting COVID tested before they come in, so we're negative. Limiting the number of family members to, try and minimize that. People are wearing masks, obviously, when they're in the hospital for outpatient tests, temperature checks. So, we're doing all the appropriate things to kind of minimize things and make our patients feel safe at the end of the day, because that's what we really want. We want them to come here and feel like they can get the information we need in a safe manner. Because as we all know, even though the pandemic has occurred, none of these other problems have gone away. Their epilepsy didn't stop happening, their brain tumor didn't go away. We still got to help the patients that need our help.
Dr. Willies, thank you so much for making time for us today and for featuring in one of our spotlights. It was really informative and insightful, and to find out about the world of MEG and utilization, and really interesting to get an update on how you've been coping as well in these sort of turbulent times. So thank you very much.